We anticipate hearing back from the Supreme Court in June on where they will go with deciding whether the Affordable Care Act will stand in whole or in part, whether the Medicaid expansion will go forward, whether there's a mandate to purchase insurance. The mandate, again, being one of those economic inconsistencies in that it's a historically conservative Republican principle, and certainly underlies all of the successful health insurance plans that are in the world. Everyone in. That's the way that you spread risk. That's the way that's the most efficient way of doing it. And if we value efficiency, like we say we do, if we value accountability, like we say we do, then we would organize our healthcare system in the broadest possible sense from a single entity so that we have the same coordination, we have the access to the information we can to really make data-driven decisions. Again, we say that we want data-driven decisions unless the data happens to conflict with some other goal that we have, in which case then it's conveniently ignored. So when we have a single entity that has the information, which has transparency of cost interactions, which has the efficiencies of having a single place. We're not duplicating things across multiple insurance programs, multiple insurance providers, and in some places hundreds if not thousands nationally. There's a fragmentation that's built into that. If we're unifying a lot of this, then we get away from that. That's why the VA system, which is a truly single-payer government-run system, that's why Medicare, both of these have got very low administrative overhead rates. If you look in the private system, you can have overhead rates of 30%. And that means 70% of that goes to care, but 30% goes to profit. In Medicare, you see that reduced to 4%. That's a cost-effective model. Patient satisfaction is high in Medicare and in the VA, and the quality is also high in the VA and in Medicare. And so I really push back against the, we like to throw darts at government-sponsored anything or government-provided anything, but I fail to see how the private system has secured my health care in any better or more effective way. In fact, you can point to rampant examples of how there's more fraud, waste, and abuse in the private sector and more of a denial of needed care. So again, I just would like to come back to our inconsistencies. Where the Supreme Court might go with this, however, is if they strike this down, then we're back to square one. This gives us a new opportunity to really envision what's the healthcare system that we need and want in this country. What makes sense for us both economically and from a health perspective. So I think strategically, again, the Supreme Court is going to do what it's going to do, but our response as a community, should they strike it down, is to lament the possibilities that were lost with the benefits of this Affordable Care Act, but do we come back and do we reassert the need for at least a public option that gives a nonprofit model that might serve as a platform for a future single payer? Or we might redouble our efforts and just say we really have to go with a single payer model that's exercised in many other countries and not necessarily always a government focused one. For instance, we're most familiar with that's been promulgated in the United Kingdom and in Canada, or in Britain and in Canada, where it is the government that's really at the focus of that. But we overlook systems like Germany, Japan, Taiwan, France. These are all private markets. Now, they're nonprofit markets, but they compete with each other. They actually have several different plans. Still a single payer in that it is government financed, but you can also have this in a way where you are competing on very private market characteristics like patient satisfaction, quality of outcomes. And that's where they've achieved some real good outcome data and outcome measures internationally that we're just not seeing here. The World Health Organization has rated the United States number 36 in the world in healthcare outcomes. That's absolutely inexcusable, particularly given the money that we pay into this, particularly given the pride that we take in being the best, in having solutions to common problems. So when we think about reasserting the need for single payer, when we think about reasserting the need for even a public option as a watered-down version, I think these are the opportunities of really continuing on forward to make sure that we're finishing the job that the Affordable Care Act couldn't do. Now, if the Affordable Care Act ends up standing and we're moving forward with implementation, the real risk is that we get so myopic in focusing on the Affordable Care Act and what that's doing, that we lose the perspective on where we need to go with the people who remain unserved, with the inconsistencies and fragmentation that we will still have. So I think still being engaged, still continuing to talk about what we need from a responsive healthcare system, however that is. The efficient model would be to do that from a single unified system, albeit still privately administered, but publicly financed. I think that's where we need to go. And we talk a lot in the political circles about what our founding fathers would have wanted, and there's a lot of myth that's included in that. But I think it's fairly straightforward in the Constitution when it says that we're providing for the general welfare, protecting the general welfare, or promoting the general welfare is what the term is. What does that mean? What does the general welfare mean? And when you look up the definition of welfare, it fundamentally includes health. And so I come back to, and as we are fond of doing in the political circles, coming back to what did our forefathers want, and what would our forefathers stand for, and what was the vision for providing and promoting the general welfare in this country. I assert that my welfare includes my health, all of our health. And that we have to have a system that really looks at all of the general welfare, which means all of our health. And again, I think we come back to the need for a single-payer system as the most efficient and effective model for getting there, not just in terms of human rights, but in terms of the most common-sense economic model that would then help us get on top of our deficit and get on top of a number of other cost deficiencies that we're currently grappling with at the individual level as well as the system level. So I know I've walked us through a lot of different points here in terms of where we are, what the Affordable Care Act does, where our inconsistencies are in terms of our economic philosophy, and the promise, or the hope anyway, of a single-payer model here in the United States. But I would absolutely encourage us to continue to remain strong in looking at where we need to go and what we need to get out of a healthcare system that meets all of our needs. So I appreciate your listening to me and my thoughts today, and wish you well in your own advocacy toward a single-payer system. Thank you.